I'll tell you that usually our initial phase of what we focus on first is preventive therapy, because too often this is underutilized in many, many practices that we work with. So we focus on preventive therapy as an important role. We focus on the role of periodontal therapy as well as a critical role. But the most important role, and one that's most often overlooked when it comes to hygiene, is that role of a patient treatment advocate. Okay, so we're going to talk about each of these roles here this morning and how adapting to change and really going after everything that we can offer to our patients in each of these roles can help change your world. Now, one thing I want to put out from the very beginning, make sure you understand, is that for me, it's not about the production at the end of the day. It's really not. It's about serving the patients at the highest level possible, giving them the best possible treatment. Your patients deserve the very best you have to give them. And one thing I found is if we serve our patients at the highest possible level, the production takes care of itself. It naturally follows. If you have low production in hygiene, I'm almost 100% certain your patients are not receiving the level of care they deserve. That's a fact. Okay, so we're going to talk about the role of preventive therapy here first and foremost. And again, this is something that's changed over the years. Current research is telling us a lot more about the decay process than we may have known in the past. Anybody heard the term CAMBRA? Okay, caries management by risk assessment. This is something that's come about because of science, and the American Dental Association has basically established a formula for us to be able to serve patients better. Now, in dentistry, we're very good at filling up the holes and repairing the damage after the damage has occurred. Too often, we lose sight of what we can do, strategies that we can incorporate that will help prevent the damage in the first place. That's what CAMBRA is all about, establishing what risk status our patients are, and then adapting and molding our treatment plan and our treatment protocol based on what risk that patient has for decay. Okay, so what we are learning from science is that it's not necessarily the sugar content that's part of the equation, that's part of the problem, but collectively studies are showing us that it's the low pH in the oral environment that causes the most widespread destruction, and that's when we have chronic infection, is when we have a low pH environment. Okay, and this is important, this is powerful, because when we have discussions with our patients about their risk status and why they have a chronic infection or continual problems, those patients that say, no matter what I do, I brush, I floss, and I always have a problem. Those patients that say, bad teeth run in my family, it's in my DNA, and there's nothing I can do about it. You know, I understand the emotion behind that statement, but it's not a valid statement. There are things we can do about it. So this is a powerful conversation to have with patients when we look at the low pH of the oral environment. Okay, now here's an image. I'm sure some of you have seen something like this, but when we really look at how at risk our patients are and why they have consistent, continual problems, this says a lot, doesn't it? Okay, sugar content in popular beverages. Now, many of us have been talking about the dangers of sodas for years, right? But this image shows us that there are other beverages that our patients are drinking that are also providing, I guess, the driving force behind chronic infection. The one that surprised me the most was the bottle of water, right? Here's a pH chart. On this pH chart, you'll see brands of not sodas, not soft drinks, but what brands of products are you seeing on this chart? Water. What? So when I started studying pH and risks and risk assessment and how to have these conversations with patients, I was absolutely blown away to realize that my patients that are drinking bottled water because they think it's a healthier choice, they don't know that there are some brands of bottled water that are almost as acidic as soft drinks. Check this out. We're talking vitamin water, Propel, Dasani, Aquafina, 5.0 and below. Now, the threshold for enamel demineralization is 6.5. Sorry, rephrase that. Enamel begins to demineralize at a pH of 5.5. Exposed root surfaces, those class 5 areas where there's been recession, those begin to demineralize at a pH threshold of just 6.5. So it doesn't take much, does it? Patient chugs the Dasani water, and it's well below the threshold for demineralization. So when you begin to have these conversations with patients, it's like a light bulb goes off. That's why I have a problem with decay. Okay, so it's fascinating when we really step back and look at the science. Now, what does the American Dental Association consider a patient to be high risk? When do they consider a patient to be high risk? Well, if they have 3 or more lesions in the last 3 years, if they have suboptimal fluoride exposure. Now, one thing I find really interesting is even in areas where there's fluoride in the water, do patients drink the tap water? No. Not very often. But we say, oh, we've got fluoride in the water, we're good. But we don't ever stop and ask the patient, are you actually drinking the tap water in your area? Okay? If they have xerostomia or dry mouth, the ADA considers them to be high risk. And the most recent list of medications that cause xerostomia and dry mouth, there's more than 600 prescription medications that cause this. The list of medications that cause xerostomia or dry mouth that are over the counter is 27 pages long. No wonder, right? Because once the saliva content is reduced, there goes the body's own natural defense mechanism. You add that with another high-risk habit, that Diet Coke after lunch, that big gulp all day long at the desk, it's no wonder. And we can have patients that have been cavity-free for many, many years, and all of a sudden we have 17 Class 5 cervical restorations that need to be done. What on earth happened there? Well, it's interesting, once you become aware and have some of these conversations with patients, it doesn't take me very long to figure out exactly what happened. It doesn't take very long at all. Okay, so many of our patients have multiple factors that may increase caries risk. They have more than one. In fact, many have often more than 10 factors, because here's the list of factors as produced by the ADA. The ADA says all your patients have to have is more than one of these items, more than one. But look down this list. I mean, this is stuff that's not very difficult. Multi-surface restorations, exposed root surfaces, irregular dental care, poor family dental health, poor oral hygiene. These are things that many patients have a lot more than one, yes? Okay, so that's what we're finding is many of our patients are high risk for decay and they don't even know it. And just because a patient has been low risk in the past doesn't mean that they are always going to stay low risk. Absolutely not. The ADA says a patient's risk for developing caries is a moving target. Things change. People evolve. We may not have ever been taking medication before, but now we are, and it's dry in our mouth, so we're sucking on a butterscotch all day long or a peppermint candy to alleviate the dryness, and that's why we have chronic infection. Okay, so it's interesting once we really take a look at it. So one of the things that I realized was missing in my discussions with our patients is a way to have the risk assessment conversation in patient-friendly language, okay? You and I can talk about risk status and pH level and enamel threshold for demineralization in a completely different language than you can with your patients. So we created a proactive prevention brochure, and there's an example of it for you here. And we use this tool to have the risk assessment conversation with our patients. Okay, so on the inside, we've taken the Caries Risk Assessment Survey as produced by the ADA, and we've made a really quick and simple survey for patients. Now, most of this I fill out on my own. I can tell just by looking with the patient where we stand on this list. Okay? There's certain things that you're going to have to ask the patient down here in the habits section, which is the third section down. You know, are you drinking soda or low pH beverage? Are you having snacks between meals? You know, those types of things you're going to have to ask the patient. And we ascertain what their risk status is. And you can see on the lower left-hand side of that brochure, we have a high, moderate, and low. And we will circle that and let every single patient know they're at high risk. And there's something powerful in this conversation, especially if this patient has multiple factors that gives them or causes them to be high risk for decay. Because then when you're circling 1, 2, 3, and you go and they've got 8 reasons that they are at high risk, they get it. And now they have, I guess, a reason or an explanation for why they seem to always have a problem when they come to the dentist. Okay, it helps them own the situation as well. So with that said, would you like a copy of that brochure? Okay, so get out your cell phones right now. How many times do you have a speaker tell you to get out your phone? I know it's a little counterintuitive, but get out your cell phone. And you can send a text right this minute. You send a text to the number 1512, the team, or again, if you have a cell phone, do not type in the letters THETEAM, but use the other number here. But if you send a text with your name, email address, and destin, I have a special copy of this brochure for you. You should have it in your email inbox before you leave the conference room today. So you will be able to immediately take that with you. Okay, so you'll be able to use that risk assessment. Does everybody have the number? No. Can we just go back to that? I'm sorry. 512-843-8326. Now, those of you that are not very technologically savvy, if you would prefer to send us an email request or call for your copy, feel free to do that as well. And when I'm finished, I believe in your handout you have all of our contact information. So I will go ahead at the very end and display email addresses and all of that. Excuse me. So I'd be happy to share that tool with you because it has been powerful in my practice with our patients and with many members that have incorporated this and are using it to help your patients become more invested in preventive solutions. Okay? They need all the help they can get. And we have a whole menu of preventive options that we provide to patients. I will share a few of those here with you today. Of course, the most powerful agent that we have is fluoride. And too often, we find that fluoride is offered consistently to children, but not very consistently to adults. Because we have made the judgment, or maybe sometimes our patients have told us, that they're not interested in anything that insurance doesn't cover. However, when we have that risk assessment conversation and we start talking about solutions, it's amazing the shift that happens in the patient's willingness to listen to solutions when they realize they are high risk. And they also realize that just because they've had a problem with chronic infection in the past, they don't have to settle for that going forward. They become very interested in having a discussion about options and things that we have to help them. So again, fluoride is a valuable tool for many of our patients. Recent CRA studies show that if they have fluoride consistently in the chair after we've polished their teeth, we can reduce new cavities by as much as 75%. That's big. That's really big. We know that fluoride helps prevent cervical decay. So if the patient has exposed root surfaces, this is a viable service for them. Okay? We know that fluoride reduces sensitivity, and 80% of the patient base has sensitive teeth. We also know that fluoride can prolong the life of crowns and other restorations. So one thing I know is that in the past few years, patients have become very savvy with their money. And they become very interested in preventive services when they realize that this is a very smart investment for them to make going forward. Okay, so again, if they've invested in even just 1 crown, a fluoride service at $25 or $30 makes good financial sense. It's not what you say, it's how you say it. I don't ever want my patients to feel pushed or oversold into anything whatsoever, ever. So I will tell patients all day long, look, my job is to let you know of any opportunities I see that would benefit you. Your job is to let me know what you'd like to do about it. Okay, so we don't ever want our patients to feel pushed or oversold, but if I prejudge that patient and withhold the opportunity for them to have fluoride because it's not a covered benefit with insurance, I failed that patient. That's their choice. Okay. Could I clarify if I'm posing fluoride or recommending fluoride for adult patients? Absolutely, almost 100% of the time. Okay? And I'm going to go over the acceptance that we get. Okay, because science is undisputed in this area. Topically applied fluoride benefits everyone with teeth, especially after they have been polished, coronal polished. I wrote an article for the Practical Journal of Dental Hygiene not too long ago about the effects of prophy paste on the enamel. We're removing microscopic layers of the enamel, and if we don't replenish that with fluoride, science shows and has proven that that patient walks out the door worse off than when they came in. Okay, that's why there's a whole push in our profession for selective polishing. Okay, so we know that there's tremendous benefits to fluoride, and that patients recognize the value of investing in fluoride, even in a crazy economy. Okay, so when we work with practices, we don't just talk about these principles, we help you master them. And mastery of offering fluoride to adult patients in my world means 95% acceptance or higher. And we have clients that are at 100% acceptance. Now, they don't have 100% acceptance for the entire year, but we have hygiene providers that 1 month, every so often, they're able to pull off 100% acceptance for that month. And we celebrate that. That's a great accomplishment. Okay, so again, fluoride is not the only answer. It's just one of many preventive services on the menu. But what does it really mean? What does this mean for hygiene profitability? Well, if we have, on average, eight patients a day in hygiene, I would say that's the average. We work with 3 different models of hygiene. We have practices that are doing traditional hygiene, which I consider 1 hygienist, 1 operatory. We have many practices that are doing an assisted model of hygiene, which is powerful. We have other practices that are operating on the 3rd model of hygiene, which is multiple providers, multiple operatories, and sometimes they may or may not have a dedicated assistant. Okay, but with this model of hygiene, if we have $25 is the fee, and we have an 80% acceptance of in-office fluoride treatment, that means an increase of more than $34,000 a year per hygienist. So it does matter. Okay, it does matter. Another viable solution or preventive option that we recommend to patients consistently is sealants. And again, patients are very interested in prevention. Now, I always have conversations with dentists, and I had one just yesterday that said, we don't even do sealants anymore because we had so many problems with failure. And I hear you, but I would tell you that as much as your resin materials have improved over the past 10, 15 years, so too have sealant materials. We get 98% retention with sealants. There's absolutely no reason that every practice shouldn't be placing sealants. Now, I'm not talking about a preventive resin where that's scheduled on the doctor's side. That's a different matter entirely. I'm saying every practice should be offering sealants in their hygiene department. I have loads of research that prove even when there's early decay, incipient decay in that groove, if the sealant protocol is good, we will arrest that decay from progressing. Okay? So sealant materials of today are very, very different. That was then, this is now. I get it, that was then. Sealants were a frustration, they failed too often. Now, we just don't see that happening. Viable procedure, and the ADA stands behind it. They said that everyone has a 95% chance of eventually experiencing cavities if sealants are not used in those areas. Okay, they also say that the application of sealants is an extremely simple procedure. From a health standpoint, sealants make excellent sense for both children and adults. This was a shift for me, because we were very, very good about presenting the opportunity for sealants to all children, regardless of insurance coverage, regardless of location. We did not focus just on permanent molars only, right? Why did we begin to focus on permanent molars only? Because that's what insurance would pay for it. And we had made a prejudgment that if insurance didn't cover it, our patients wouldn't want it done. But I'll tell you what, I changed my mind, because when my children's teeth erupt, which ones did I seal? All of them, every available groove. And why should my patients' children be treated at a lower standard of care than my own? That's not fair. Every parent deserves the opportunity to choose the very best for their child, and that's what we make possible. Okay, so not just children, though, adults. And you might say, well, Wendy, come on. If they haven't had a cavity in that groove, they're probably good, right? Well, what did the ADA Council of Therapeutics say? There's a 95% odds that it